Hello, I'm Dr. Pong Kwai Meng. I'm a consultant pediatrician and neonatologist in Penang Adventist Hospital. Preterm babies, we can subcategorize them into the following three categories. For those who are born before 28 weeks gestation, we categorize them as extremely preterm baby. Whereas those duration of pregnancy between 28 weeks to 32 weeks, we categorize them as very preterm babies. Those who are delivered between 32 to 36 weeks plus 6 days to be exact of pregnancy are categorized as what we call moderate or late preterm babies. The incidence of delivery, preterm delivery in Malaysia is about 12.3%. Depending on the baby's so-called gestational age, how preterm the baby is, some babies actually will need to be sent to either intermediate special care nursery, or those who are very sick, very preterm babies, we may have to nurse them in what we call NICU, Neonatal Intensive Care Unit. So we will have to have a special team, consists of a doctor or neonatologist and a team of neonatal nurses. Because this group of babies, they need special care, so usually the obstetric team, they will get things prepared in the delivery room to receive these preterm babies who may need some help or support. So usually we will prepare all the equipments ready to make sure the baby is breathing and can maintain normal heartbeat and blood pressure after birth. So all this equipment, life-saving equipment, is always ready to be used in all delivery rooms. Preterm babies, the organs in the bodies are not well developed. The organs are still not mature, so there are possible complications that may happen, which can be short-term or long-term. It depends on the baby's so-called the duration of the pregnancy. The earlier the baby is delivered, the higher the risk of the baby developing complications. The common complication that we may encounter in a preterm baby is actually breathing problem. The preterm babies' lungs are immature, so usually there will be lack of a substance called surfactant, which is very important for the lung to be able to expand normally. What we usually do is, in this group of babies, we can actually give medication to mother just before delivery to enhance the maturation of the lungs, to make the lungs more mature, so the baby will not need so much help after birth. And if the baby develop difficulty in breathing after birth, we can actually support the baby's breathing by using a machine, or what we call ventilator, to support the baby's respiration. And if some babies, if they are doing better, they can breathe on their own, we can actually support their breathing with a device called CPAP, Continuous Positive Airway Pressure, CPAP. So that what we do is we actually apply a little bit of air pressure through this device in order to help the baby's lung, open up the lungs so that the baby can breathe easier. Complication that may happen in a preterm baby is actually a heart problem. A condition, we call it patent ductus arteriosus, or PDA, the short term. Basically, a lot of preterm babies, they have this blood vessel which is connecting the aorta, the main blood vessel coming out from the heart, and the what we call pulmonary artery, and the arteries is coming out from the right heart to the lungs. So this connection, this blood vessel usually will be closed in all newborns, either within a few hours or within 24 hours after birth. But in preterm babies, this blood vessel remain open, and sometimes it may cause a problem to the baby, and the baby may develop so-called heart failure, and the baby may have problems in breathing. So, but this condition can be treated medically and in some cases by surgical intervention. And the next complication that may happen in preterm babies is actually bleeding in the brain, which is very common in those who are born extremely preterm. But fortunately, this kind of complications is less common nowadays with the advanced care and technology that we have in our neonatal intensive care unit, and usually the child will recover without major impact. And the next complication for preterm babies that we may observe actually is feeding intolerance. They usually cannot be fed too soon, so we have to increase feeding gradually, preferably with mom's breastfed milk, before they can achieve full feeding between 1 to 3 weeks. Meanwhile, we usually will put them on what we call parenteral nutrition, which means we are giving the nutrients, the proteins, fat, vitamins, or the micronutrients directly infused into the baby's vein or the blood vessel during usually the first 2 weeks of life. And the other common complications that we observe in preterm babies is actually infection. Preterm babies' immune system is not mature, it's not well developed, they are very prone to infection. Fortunately, we have very good antibiotics that can be used to treat infection in this group of babies. That's why we are very particular about hand hygiene in neonatal intensive care unit before we handle the babies. In our other complication that we observe in babies, actually a very common, a lot of preterm babies, they develop what we call neonatal jaundice or newborn jaundice. It's a very common observation. The main problem is because baby's liver is not mature, and the jaundice actually is a yellowish discoloration of the skin and the eye because of the presence of a substance called bilirubin in the baby's blood. But fortunately, a majority of them will do well and will respond to a treatment we call it phototherapy to help the baby's system to break down the bilirubin in order to reduce the severity of the jaundice. The other possible complications that can happen in preterm babies, especially those who are born very preterm, those who are less than 28 weeks gestation, who require respiratory support with oxygen, frequent transfusion, and so on, is actually the eye problem. A condition we call it retinopathy or prematurity, or the short term we call it ROP. Basically, this is a condition where there's abnormal growth of or overgrowth of blood vessels and swelling of some of the blood vessels in the light sensitive layer of the nerves behind the eye, which is called retina. Group of babies, some of them may be very unfortunate, and overgrowth of these blood vessels sometimes may cause scarring of the retina and which can actually pull off the retina layer of the eye and can subsequently lead to blindness. We need to screen all these newborn, this condition regularly, usually from 1 month onwards. All these preterm babies are also prone to hearing problems, especially because of their fragile conditions where they need to be treated ventilator or with respiratory support, as well as receiving some of the antibiotics which may be toxic or harmful to their hearing. In our neonatal intensive care unit, we always make sure that all our preterm babies will have their hearing screen done before they are discharged from the ward. One of the main problems of all these preterm baby is facing is actually what we call hypothermia, which is low body temperature. The main reason is because all these babies, they are very small, they have very little fat under the skin, and they lose heat very fast to the surrounding, and they can actually develop problems respiration and also low blood sugar when their body temperature is very low. So they need to be nursed under what we call open warmer to maintain a body temperature. And in those who are very small babies, we actually have to nurse them in a closed incubator. So in order to maintain a normal body temperature, they need to maintain a body temperature in order for them to grow normally and healthily. There is a way to maintain body temperature that we can actually allow the parents to be involved in nursing care, which we call it kangaroo mother care, which basically it means that the mother and the baby actually have what we call close skin to skin contact. We allow the mother to carry the baby on their chest without the clothes. That means that skin to skin contact that actually can maintain the baby's body temperature within the normal range. And there's also a lot of evidence that show that this practice actually can reduce the incidence of infection, and most of these babies can be discharged from the neonatal ward earlier. Every year we are managing about 30 to 40 preterm babies in our unit. We have some very small, what we call extremely preterm babies. The smallest we have managed here is 24 weeker. One of our smallest babies is 570 grams. And I would like to share with you here a story with good outcome of a preterm baby who was born at 26 weeks gestation, 26 weeks pregnancy. So this baby was birth weight was 670 grams. The baby was critically ill for almost 1 month. Baby was on ventilator for 1 month, critically ill with a lot of complications. But fortunately, the baby make it with all our tender loving care and all the intensive care equipments and our nursing staff. This baby managed to make it. The baby stay here, stay in our NICU for a total duration of 3 months, close to 100 days. And she was discharged well with a body weight of, if I'm correct, about 3.2 kilo. And she's 6 years old now. She's doing very well. And she has normal developmental milestones. And the mom gave me the feedback that she's a very intelligent girl.